Okay. Go ahead.
Hi, everyone. This is a quick introduction to our in-vivo presentation, urgent care versus emergency care. Margaret and I, we were supposed to contact these facilities. I contacted an urgent care facility about the following patient scenario. So I'll just read the case. In February, your daughter jumps off the second floor banister of your home onto a beanbag chair and fractures her ankle. You take her to your local urgent care facility. As luck would have it, you haven't even received your daughter's medical bills when your son fractures his ankle jumping on the trampoline. The urgent care facility is closed, so you take him to the hospital emergency room. You need to know how much the medical treatment at both facilities will cost. So as I mentioned, I went ahead and contacted the West Jordan Clinic, Intermountain West Jordan Clinic. And in the presentation, you will see more in the details. I just wanted to summarize my experience with this project and also contacting the clinic for an estimate of that broken ankle. I personally had a little bit of a hard time. They were not as open to give me estimates. They were giving me all sorts of reasons, and I was transferred a lot from one department to another, left messages to a person that I was referred to in the billing department, and I have yet to receive a phone call back. And this was all, last week and a portion of this week. Most of the information that I got, it was through my insurance provider, Blue Cross Blue Shield, and that's how I was able to actually fulfill this assignment to the best of my ability. So basically, that was my experience. This was really interesting to compare with Margaret. The costs and to learn a bit more through my insurance provider, to learn a little bit more about how the explanation of benefits like the EOB works, the adjustments and payments, and all the little details that I also mentioned in the presentation. So very good experience. Little hard, a little difficult too. I didn't think it would be this hard to get an estimate for a broken ankle. But still, it was a very good, very, very good experience. So now I'll go ahead and turn it to Margaret, and she will discuss her parts a little more.
So I decided to call my local emergency room, which is American Fork Hospital, and looking and navigating through their website, I got some phone numbers to call for billing and things to get an estimate on pricing. And they were able to give me, I called billing and they gave me a phone number, which was very helpful. It's a price estimate phone number, and you call them and you tell them what the situation is. And then they look through their files to see similar situations, and they can tell you how much that patient paid, or not how much they paid, but how much the bill was. So they said it's not an estimate, but an actual average cost of what you would pay on that situation. So I told them about the broken ankle, and they found a similar situation, which cost, and the cost was almost $1,700. Of course, it's an ER, and they couldn't give me the cost for the attending physician or for the radiologist who interprets the x-rays. So it's just the cost of being in the facility and having the x-ray done, and the cost of applying the splint to the ankle. So also I called my insurance company then to see what discounts can be applied when you go to what my particular insurance would give when going to an ER. And they were actually less helpful, because unless you know exactly the code, which I looked up online some codes for broken ankles, they still could not give me what the discount would be. They said each situation was different depending exactly on what kind of insurance and coverage you have. And finally, they gave me a little bit of an estimate as to what I would have to pay with the insurance that I have. So I think we definitely learned that it is a lot cheaper to go to urgent care than to an ER. Last year, I had the experience of having a kidney stone, and I thought I'd save myself some money and try to go to an urgent care versus a ER. But as soon as they looked at me and they confirmed that they agreed with me that they thought I had a kidney stone, they said, you need to go to the ER. So there's definitely situations that you have to go to the ER that the urgent care will not be able to help you with. So I hope you enjoy our presentation.
Thank you.